The purpose of both the TED Stockings and the Sequential Compression Devices, or SCDs, are to promote venous return. So sometimes, most times, patients in the hospital, they're not moving as much as they would at home, whether that be immobility reasons or just because they're in the hospital. You want to prevent blood clots and blood from pooling in their legs. So these two devices are ways to do that. So the sequential compression devices kind of stimulate that walking movement when they squish in and out. This video is to describe how to put on TED stockings. So the ones we have here are the knee-high ones. And for the sake of this video, I'm not gonna have Liam take his socks off, but normally you have a patient do that. So first things first is make sure they're the appropriate size for the patient. You don't want them too loose or too tight so they're cutting off circulation. These ones are a fine fit for Liam, and they're also the only ones we have. So first you wanna put your hand in to the sock and turn it inside out on itself. This just makes it easier to slide onto the patient, I've realized. So then you're gonna take it and put it on the patient's foot. Once you have it on, you're gonna take the top part and slide it up. Fix the toes. Make sure there's no wrinkles, because that just is added pressure that you don't want. And the top can sometimes wrinkle under their knee, but you don't want it to, because once again, that's just more pressure and it makes it tighter for the patient. So that's how you put on a TED stocking. This is how to apply SCDs, or the sequential compression devices. So grab your device, and usually we'll have a picture. So this side is towards the patient's head, this side is towards the patient's feet. So put it under the patient, right in the middle. And you don't want it too high on their leg or too low on their leg. So you flip one side over, and then this side has little Velcro straps that you put around. You don't want to secure it too loose or too tight. You want to have about 2 fingers be able to go underneath it. And there are different sizes sometimes of these too. You just have to look at your hospital. And then you attach it to the tube on the device and turn the device on, and it will automatically compress and release.